First of all, the medical school absolutely will stay in Shreveport. There have been people saying that it needs to be moved elsewhere. We ought to think about going to Baton Rouge, going to Lafayette. Absolutely not. This medical school belongs in Shreveport. It's going to stay in Shreveport. It's a mess right now. I know that. And by the time I take the oath of office in January, it's probably still going to be a mess based upon the litigation that's been filed. It went from a mess and let's try and see how it can be resolved to, now we got litigation and we got the lawyers involved, and it's going to make it even a worse situation to unravel. But I'm committed to unraveling this problem. I mean, this cannot go on for this community, and it cannot go on for the state. As we've transitioned from the charity hospital system to this new delivery of health care in Louisiana, we're still in the infancy of that relationship in places all over Louisiana. It's more acute, I think, in Shreveport because of the problems that exist now between the university and between the foundation and other hospitals in the area. But we're just feeling our way with how this public-private partnership is going to work. And I will tell you, I'm very concerned about the cost of the public-private relationship, not in Shreveport, but in other places. When the hospital opens in New Orleans, I'm concerned about the patient mix and the ability to meet the business plan that's been developed there, although the officials there are very confident they're going to be able to do it. And that facility opened later this month, and it's magnificent. I've toured it, and it's a state-of-the-art facility that's going to provide a tremendous amount of service, not just to the indigent population, but I think to a larger population, and that's what the business plan requires. But we have two outstanding medical schools in New Orleans and in Shreveport. Not only do they provide the medical doctors and allied professionals for Northwest Louisiana, they provide people who get into that arena from all over the state. And you've got world-class facilities in some places, but you've got world-class talent here that's attracting people who bring with them research dollars and who are going to become the leading professionals in the field. I was there this morning talking to some of them, and I understand that. And my commitment is to make sure, number one, the school stays in Shreveport, and number two, we resolve as quickly as we can this dispute that is tearing this community apart and that's tearing the delivery of health care apart potentially in Louisiana, and is going to create even more problems down the line if we don't resolve it quickly. This gets tied up in litigation for years and years and years, as is possible with the kind of litigation that has been brought. It's going to be devastating, I think, long-term to the delivery of health care in North Louisiana and the provision of medical education in North Louisiana.